So really excited to be here with Janee. We are going to be doing a extended brachioplasty, which means removal of arm skin, both sides, and then extending that onto her back. It's primarily just to remove excess skin. And you know, the reward you get for dramatic weight loss and being a weight loss superstar is you can have excess skin. That's okay. We're going to fix that for her. Really excited for you all to kind of follow along with her experience and ultimately see her results. Tomorrow's the big day and it's going to be amazing. So the first thing that we're going to do, you can see yourself, arms straight out. Okay, so the way that we design these is the best place to lay the incision down is in what's called your bicipital groove. So it's right in here. And the reason we put it in there is because when your arm is in a neutral position, it rotates down. You cannot see the incision from the front or the back. That's the goal. You will be able to see the incision when you raise your arm, when you wave, that kind of thing, okay? Now, you can see the excess skin goes to your elbow, slightly past it, so we're gonna have to get to there. So it'll probably be somewhere around there. I'm gonna find my anchor point there. Looking good. It's so funny because you don't have a lot of excess here in your armpit area. It's localized here.
Though. Yeah.
It will. But that will be fixed mainly with the back lift because that's, do you see how that happens? Okay. So, right now what I'm doing is I'm simulating the skin removal, okay? Not a ton of stretch on this side. The skin mostly comes from the back. Right. So this is essentially where it'll be. You see, you don't have a lot of stretch here. Where it happens is right here. Everything wraps around. What we're gonna do also is thin out this fat pad with some lipo so that when I remove the skin, I'm only removing skin. It's really important that you don't remove the lymphatic vessels, especially, that can cause distal arm or hand swelling that can be permanent. It's always a risk with these, but it's very, very low with this technique where I liposuction out everything. I'm maintaining the inner architecture and then only removing the skin. So that's why we do it like that. We don't just take out this chunk of skin completely like that. And then when we decide how far to come anteriorly to the front of your chest, the way that we determine that is we don't want to pull your breast laterally. If I pull too hard, your breast moves laterally. Right. Okay. So we need to avoid your breast tail, which goes this way. Pull as much as we can without displacing your breast. So that would be like right in there. Okay. Now the next leg, mark the other arm. Okay. And then we'll get the back side. So again, similar type situation. We'll be going just below your arm. I don't think it makes a lot of sense to really go into your forearm. You don't have too much excess here as long as you're fine with that. I would prefer not to. Okay. We could sometimes go to about there. If I really, when I bring things together, feel like it needs it. What we don't want to give you, remember, you've done a great job in your weight loss, right? But we don't want you to look imbalanced. Right. We don't want these tiny little popsicle stick arms, right? Which I'll have the freedom to do. If I chose to be extra aggressive, I mean, I would be taking everything. And then the problem is you're narrower here than you are on your forearm. It's imbalanced. Right. So you would take, everything is just with taste. You need to, that's where the kind of the artistic aspect of all of this comes from. Gotcha. So that's where it would be. And I'm going to be doing very similar markings to you tomorrow. Okay. And then again, right down. Okay. I'm going to pull this just a little bit. Okay. Good. Now, what I'm going to do is I'm going to get the back side of your arm, and I'm going to be swinging under your arm. Okay. There we go.
So my main concern with the back side, because like you said, I have a lot, it's on this side. It's this overhang, and I wondered how does that end up looking if the incision is to the side?
So when you take it, we're going to be taking, so let me find my point. We're going to be taking all the excess skin. Where the pull comes is when we construct your armpit. So we're going to be doing a little bit of a pull. It'll be pulling it on, it'll be putting you on a little bit of tension, but This isn't, so an arm lift that does this it pulls the skin more circumferentially than lifting everything this way.
Right.
So there's a small lift, so you may have just like your elbow skin, like right on the elbow, you might have a little bit of laxity, but if let's just see, I'm going to demonstrate kind of what our pull is.
Okay.
So the way I do it is I just kind of take I'm imagining where this floats in the air, and I'm going to take the other flap of skin and bring it there, so I know how much tension I could put it on. So essentially, we're going to be bringing all this skin over this. Okay? This part of the skin will be coming all the way around like this, and then that is kind of how it'll look. But you see, you have a little bit of excess here. I'm going to be tightening it up as much as I possibly can, but you'll see you may have when your arm is perfectly straight like that, just a slight amount of redundancy, but I'll be able to take it up some with the back lift. See that?
Yeah.
Like that.
Yeah. See, I don't care, because nobody holds their arms like this, but we're like this, and that's what I care about is this having a bunch of...
Yeah. I mean, once I bring this all back, you shouldn't. Okay. Yeah. You may have just like do you see this like little crease that you have here? Yeah. You have like a little tight crease that's kind of in your elbow. I'm going to try to lipo that as flat as possible. You might have a small crease there. Right. But I'm going to do my best to minimize it. But do you see that? Yeah. See how it's just right there? That's it.
And it's like I'm not striving for perfection, obviously. But
how's it going?
Good. How are you?
Nice to see you.
Nice to see you too.
Hey, how's it going, Dr. Rona? Nice to meet you.
Yeah, this kind of comes up again. The back is going to be something that's going to be pretty impressive that I'm really excited about. And let me just give you a little pinch here so we could really see how much we're taking. So you don't have as much laterally on the back, so we'll be kind of going in here. So you see that? That tightens you up there. Now this is where the real magic happens. You see all of this excess folds here? Right. Yeah. I think about where your bra line sits, and that's usually right about there, just inferior to the axilla. So there's not a lot of pull that you go down, so we're going to end up somewhere like that. This arm up, we're going to end up somewhere like that. Okay. And when it pulls down, I want it to be nice and flat, ideally, and lying under the bra line. Now, this is where it gets really neat. So, when we do this, so I want you to pay attention even to your waist, all the way down. As soon as we take this, let's see, this side's probably better. So all of that comes up like that. See that? All of those folds are gone. Down here, this is more for tummy and backside. This fold right here, little bit of tummy and backside, but all of this is with the bra line upper back. See that? And again, when I see how much we're moving you, it's going to be, I'm going to be probably down right around there.
So right under it, because I know I have this side bulge that I can see from the front.
That side bulge just needs to be flattened. That's all. Because once you do that, feel that. You don't have a side bulge. Yeah. That's skin. That's not fat. Gotcha. Yeah. So if I see any contour irregularities though, after I bring this up, I will lipo you as well. Okay. So yeah. Your resection is going to be just below that top little basically. And I think the camera can really see that. But as soon as that, so basically everything between those lines is gone. What did I say before? 6 inches? Yeah, that's actually probably more than 6 inches right there.
You said since this is coming up, this gets pulled up.
So watch this.
Oh, yeah.
See that?
Yeah. Wow.
Isn't that amazing?
Yeah.
And that's where the fold used to be, but that'll flatten over time. There is very little fat in here, so there's very little liposuction. Right. I think you're going to do really well with just that. So essentially the back lift is going to put you here. Okay? See that? Yeah. Got it? Excited? Great. And then let me just finish marking this arm. So, skin quality is really good, so I'm excited about that. my hope is that you'll heal super well.
I've never had an issue with healing with both of my C-sections and my gastric sleeve, so I'm hoping recovery won't be terrible.
Okay, so the difference,
okay.
It's a little different.
Okay.
The gastric sleeve is internal, so you feel these gas pains. Yeah, you have core soreness, but the gas pains are something that's unique to laparoscopic surgery. With this is all skin. There's no muscle, so that's good.
Yeah.
The pain is in the skin. The good news is we're going to be using special numbing medication called Exparel to give you 3 days of really good pain control, and then I give you 2 types of pain medication to just keep you comfortable.
Gotcha.
Also, managing swelling and keeping those arms elevated helps the pain improve.
Gotcha.
But it's different. It's a pain with use, and it's a more superficial pain. It's a skin pain. It's what you would imagine it to be.
Right.
But the medication and everything really helps cover things well. Usually my patients post-op day 1 are saying the pain is like a 3 out of 10. So yeah, you're going to be sore. I'm not going to lie to you and tell you, oh yeah, you won't even know you had surgery. No, that's not true. I mean, we're taking pounds of skin off you. Right. But it's well managed with our pain control regimen. So nothing to worry about there. The other thing is because I'm doing liposuction, I infiltrate the entire area with special fluid called tumescent fluid. That fluid contains lidocaine, so that's a numbing medicine. It also contains bicarb, which actually helps a numbing medicine not burn going in. You won't mind because you'll be asleep. But then it also contains medicines like epinephrine and TXA to control bleeding and prevent bleeding. So that makes less blood loss in the operating room, which is great, and less chance of you developing a hematoma, which is a collection of blood or bleeding afterwards, and it limits that drain output.
Gotcha.
To hopefully get it out sooner.
Gotcha.
But yeah, so here's the backside. You could kind of get an idea of the resection, right? So it essentially will go, I'll be taking a little bit more of that. So it'll essentially go here.
And you were saying for
This
the consult
corner.
that it kind of works out to where if I were to get a breast lift that it'll anchor together.
Yeah, the idea is to put this incision, you see where this incision lies?
Yeah.
Right in your inframammary fold. Your inframammary fold is for a breast lift, that's right here.
Yeah.
So essentially this is all lifted up. If you ended up getting a breast lift, you would have this corner is going to meet this corner. It's going to come all the way up. But you would be able to extend it to a breast lift if you needed. Yep. Everything in between my lines is gone. I mean, it's a lot of tissue. There's some weight here to this tissue, so that's really going to help you too.
Yeah. And I feel it when I'm running, so
I bet
was
you
telling
do.
my mom, I'm like...
And also the movement of it is something that's just uncomfortable to many people, and I'm really looking forward to improving that. Ultimately, that whole movement, the motion with movement, that even improves further once we get to the tummy portion, but just with the arms and back, I think that's going to significantly improve your overall function.
Gotcha.
Super excited for you.
So I won't have to worry about this too much.
Nope.
And
No, because that's taken in, if you, drop your arm now.
Yeah.
See that?
Yeah.
That's taken in there.
Yeah.
Yep.
Gotcha.
It's going to be great. You're going to do awesome.
Yes.
Questions on all of that?
You were very thorough, so...
Good.
No.
Yeah, I'm a visual person,
Me
so
too.
I like really
I'm a visual learner
outlining
as well,
things.
so...
Yeah, and this is just, it's interesting. It's kind of like sculpting, but it's almost like, it's like wrapping a present. You kind of understand where things need to go and what directions you need to pull things in order to get the best result. So I always like visualizing it first.
Gotcha.
Yep.
And then as far as like the scarring, I've seen some odd looking scars like after the fact, like it kind of look all pinchy. Like what would my scar end up?
So you can have a little bit of that because we're going to be putting multiple layers of sutures in. You're going to have at least 4 layers. And the reason is because we really want things to stay nice and tight. You want to offload tension on the incision because if you have tension, you get widening of the scar, which you don't want. So we want to keep it as fine as possible. Even though some widening is expected, especially in areas that move around a lot, like under the armpit, but we're going to do our best to offload it. So sometimes you'll see that pinching, and it's because some of the deeper suture layers are placed, it's like spot welds, And then the final suture layers are more sewn like a baseball, back and forth. So those are more smooth, but it's normal to have a little bit of puckering. That's also a good reason why the compression is important. What that does is it applies even compression to not allow you to kind of look like that, like that puckered appearance.
Yeah.
Yeah.
And so since I'm having my arms and my back, what does compression look like? Like, is it ACE wraps? Is it not faja immediately? Like
initially ACE wraps.
Okay.
So what I like to do is while the drain is in place, I like you in ACE wraps.
Okay.
And the reason is
for both my arms and my back.
Yeah.
Okay.
Yeah. Unless you have sleeves that you could put on your arms, I'm okay with that. But usually I just have you wrapped with ACEs, and that's okay.
Yeah.
It's not ideal because ACEs have like concentric compression, so you can get irregularities where it doesn't look as smooth here because you have basically rings of compression depending on how tight you wrap in each section.
Right.
So we're going to wrap you as uniformly as possible, but the main reason is it's easy to take off and put on. You may be sore, you're going to have limited mobility. Getting in and out of a faja is an absolute nightmare immediately post-op.
Right.
With a drain in place, it's normal to have a little bit of leakage around the drain. Your drain will be on one side or the other. Typically, it'll just kind of be right here.
Okay.
So it'll be easy to get to. Are you right or left-handed?
I'm right-handed.
So we'll probably put it on the right side.
Okay.
But that being said, it's still normal to have a little bit of leakage around the drain. You're dealing with some fluid, so it's very common to get the faja dirty while the drain's in, and then trying to get it off, wash it, and put a new one on is a real pain immediately post-op. It's a little bit easier to do with the ACE wraps.
Gotcha.
And we don't really worry if those get a little dirty. You can always replace them or rewrap.
Gotcha.
Yeah, but that's the idea.
So how long in the ACE wraps before I would transition to?
Anywhere from 3 to 7 days, depending on when we have our follow-up visit and how soon that drain can come out.
Gotcha.
Once the drain's out, literally in the office, we'll dress you in your faja.
Okay.
Yeah.
Okay. So my follow-up is, I believe, Thursday. With you.
That'll be fine. And if your drain is drying up earlier, we could get it out earlier.
Oh, okay.
Yeah.
Okay.
We just want to make sure that that drain goes down to about 50 or 40 cc's a day or less. That's a really easy amount for your body to just reabsorb. If it's still higher than that, you're at risk of developing a seroma, which is just a collection of fluid. One of the challenges with skin removal surgery is removing these panels of skin around. Anytime you're moving panels around, like especially with arms, the main panel is coming from the back. With the back, the main panel is coming from the bottom. It's these pieces of tissue shifting over each other. So you're left with this empty space or potential space underneath. The body loves filling that with fluid. It's healing fluid. That's what it's trying to do. So the compression, the whole idea behind the compression is to compress that space down and not allow fluid to accumulate. But fluid will accumulate. The body finds a way, and that's where the drain comes in. Any fluid that's in between those layers gets evacuated by the drain. So that's the whole thought process. There are such things as drainless tummy tucks and things. The thing is with patients that have lost a lot of weight, you're dealing with big skin flaps. And yeah, it's nice to say drainless tummy tuck, but honestly, if you have a big potential for developing a fluid collection. And if you develop one, it takes a long time to go away. And a drain really isn't that difficult to manage.
Right.
I mean, it comes out within a week, and it really does help accelerate that recovery process in terms of dealing with the fluid that assuredly will happen when you're doing larger skin removal.
Gotcha. So for my procedure, and we're talking about fluid, what's your thoughts on lymphatic drainage massages? Is it important for arm and back lift?
Yeah. I always express that getting a lymphatic drainage massage, if you could get one before the drain comes out, that's really helpful, because they'll literally move whatever fluid is there into the drain. So it's a really quick way to get one last push to get all that fluid out. Exactly.
Gotcha.
And then typically about once a week for 6 weeks. That first 6 week is that's when immature scar tissue is forming. So we really want to compress things down. We want to evacuate any fluid that's there, especially in places where I did liposuction, because when I think about liposuction, the way that I visualize it is I'm turning your tissues in almost Swiss cheese, right? So almost imagine like a sponge. So if you don't compress, the sponge will be full and it'll be a thick sponge with all like the little holes in it. The idea of compression is to squeeze that sponge down flat and let it dry in that configuration. You want immature scar tissue to form in that configuration. So then mature scar tissue forms and holds that shape. And that's where the compression, like lymphatic massage, getting the fluid out and then wearing the faja to basically get you to that ultimate final contour is really important during the healing process.
So I know for like tummy tucks, it seems like they're getting massages more frequently, but for mine, once a week.
I do the same for tummy tucks, once a week.
Okay.
I'm fine with once a week. Some people really like it.
Yeah.
They feel like they feel less swollen afterwards. They
Yeah.
feel like less inflammation. And if you want to do it more often than that, that's fine.
Okay.
But they can get kind of expensive.
Yeah. I already was looking at some like.
Yeah. And you know, some lymphatic massage places, they'll be like, oh, you know, why get 5 when you could get a pack of 10? How about a pack of 20?
Right.
I mean, you could really end up spending some serious money with those. I think that there's a point of limited return. I think that's most important during the first 6 weeks, the acute healing phase. And I really don't see that much benefit by doing it much more often than every week.
Okay.
Yeah.
Okay.
Save yourself some money.
Gotcha. So I know I've seen the tummy tucks and everyone's hunched over. For me, what's the position of my body? How do I know you said to keep my arms up, but with my back, what does that look like?
So you're going to be, your shoulders won't be hunched over, because if you think that puts more tension on that,
right.
you're going to be
So
kind of upright.
I have to.
Yeah. You're going to be more upright,
Okay.
and then again, the arms, you want to try to get them to your heart level.
Okay.
So you're going to be really reclined in bed and just kind of have those arms on pillows.
Recline, so I have to be sitting up, like more 90 degree or?
No, like a beach chair.
Oh, okay.
Yeah, like lounge chair.
Okay.
You know, something like that.
So that I'm kind of forcing myself backwards. Gotcha.
Right.
Okay.
Yeah.
Okay.
Yeah. And then getting up in things, you don't want to be reaching for things.
Okay.
And like pulling with your arms.
So-
You want to have help. So a really good way to get up is having help, either someone supporting your back and helping you get to a seated position, and then you focus on core and legs to kind of move around.
So I'm pretty much standing straight up
Yeah.
when I'm getting up.
Yeah.
Okay. Not because I do collapse forward.
Yeah.
Especially being on social media, I'm already like this.
Yeah,
I
you're
know it's
gonna
bad
just
for my
kind
neck.
of maybe get some pillows, lay them on your belly or your chest, and just kind of have them,
Stay
everything up.
Yeah.
Yeah.
Okay.
Or get those like glasses that have a mirror. So you're laying back and you're just like.
And how long do I have to be like that for? Like, how long do I need to be mindful of the tension? Really?
Yeah. For at least the first 2 to 4 weeks.
Okay.
I tell patients jeez, I keep getting that. I tell patients don't raise your arms past 90 degrees for the first 4 weeks.
Okay.
So washing your hair can be a little difficult. You need to keep those elbows controlled while you're washing your hair. Don't reach for stuff in a really high countertop or a really high cabinet.
So I'm not worried about down. I'm worried about up.
Up.
Okay.
Yeah.
Okay.
Because the place where you're going to have problems is the armpit.
The armpit.
And that stretches the skin in the axillary region or the armpit region.
Gotcha.
Yeah.
Okay. And then remember to stay like this.
Yeah, I mean, the compression garment and everything is going to kind of be forcing you back a little bit.
Right.
Yeah, you're going to be wrapped up.
Okay. Anything else I need to know? Anything else?
No.
Okay.
And here's the thing, questions come up along the way.
Right.
You have my cell phone. If you're ever worried about anything, you have questions, concerns, just a phone call away. You call or text me anytime.
Okay.
Yeah.
Okay.
You're going to do great. I'm really excited for you. And more importantly, this is going to be a really dramatic transformation. Not only just kind of physically, but to the overall function of your body. And I think that that's something that you've really been waiting for.
Yeah. I tell everybody this I can hide. Eventually we'll take care of this, but this is every day.
Yeah.
Yeah.
We'll get you there.
Yes.
I'm really excited.
Yes.
Any other questions?
No. Thank you.
It's my pleasure.
Yes.
When are you arriving tomorrow? 6:30?
Yes.
Okay, so I'll be there probably around 7:15, 7:30.
Okay.
We'll get you marked up. You'll meet your anesthesiologist. Like I said, the procedure will probably be about 5-ish hours. But
And then I know
great.
it's an outpatient, but I'm not going to be just waking up after surgery. So how
Yeah.
long am I, for my mom to come get me, how long am I?
Yeah, you're observed about 30 minutes to an hour typically, just to make sure that your vitals all look good, pain and nausea are controlled, and then you're able to go.
Okay.
But you're going to be all like wrapped up like a mummy. You'll be a little sleepy still, and you'll probably just rest most of that day.
Okay.
It is important to be moving around though.
Okay.
Despite the fact that you're kind of just in this weird position, every hour or two, I do want you out moving around.
Okay.
Like you're gonna want to kind of go use the restroom, walk around the bedroom or the hotel room a little bit. 2-3 minutes, just keep the blood flowing.
Yeah.
It's primarily in your legs.
Yeah.
If you have any compression stockings or anything like that, that's always a good idea to wear too.
Okay.
Just because you won't be as mobile, you don't want to get swollen and ultimately get blood clots or anything like that.
Yeah.
That's the thing that we worry about most, truthfully.
Yeah.
I don't worry about bleeding because I've got the drain. I'll know, right? I don't worry about infection right away. That takes time to develop. I don't worry about the wounds kind of coming apart because they're really robust. You're going to have this surgical tape on everything, and that comes off at like 2 weeks.
Yeah.
What I worry about is things like blood clots.
Gotcha.
So it's really important to be moving around. And we're going to give you some blood thinning medication right before the surgery,
Okay.
just to minimize your chance during anesthesia.
Gotcha.
Yep.
Okay.
Any other questions I can answer? Mom, anything? What do you think? You excited for her?
Oh yeah,
It's gonna be
and
good.
I'm proud of her.
Yeah. She's come such a long way.
Mhm.
That's what's such a gift in this line of work, because when I first started just doing bariatric surgery, it was already a special environment. People's lives were transformed.
Right.
Truthfully, I didn't anticipate it being as powerful of an experience, because back in the day I was considering going into plastic surgery or going into bariatric surgery. And the reason I chose it is because I had special talent in bariatric or laparoscopic surgery, and then also I felt like I can make a more significant impact on patients' lives.
Right.
And it's true, it is a very significant impact. I would argue it's more significant than the skin removal. However, I did underestimate the amount of impact the skin removal has. And the really exciting part of it is, with bariatric surgery, it's all a delayed reward. It takes a year to see those results.
Right.
And I'm waiting for patients. You see them in follow-ups, you're like, all right, you're getting there. And then 1 year out, you're like, here we are.
Yeah.
Right.
With plastic surgery, it's a little different. As soon as I cut that last suture, you look down and you're like, whoa. And that's not even the final result.
Right.
Because you're still swollen. Like I said, I put those fluids in your tissues and things, so it does take time to lean out even further. And final results take like 9 months. Because swelling and scar formation just kind of takes time to resolve. You'll be about 80% of the way there by 6 weeks. So it's a process though. But still, you get 80% of the way there really quickly, right? When I cut that last suture, I'm going to take pictures, and it's going to be pretty neat to see. Yeah, you'll wake up to those, basically.
Right.
Yeah.
No, I'm excited. Especially because, like you said, like the surgery, weight loss surgery it's a delayed thing, and then you have a lot of healing to do mentally, and that's what I end up telling people online is, you have a lot of internal work to do, and you're focused on this scale. And if you want to be able to enjoy this part, the loose skin removal part, and not still trying to figure out your relationship with food. So that's why I didn't rush my wanting to get my skin removed, because if I'm still in the mindset of yo-yo dieting, even after bariatric surgery, and then I get my loose skin removed, I'm going to ruin my results.
Yeah.
So I waited until I was a year in maintenance to be like, okay, I'm ready. And no, I'm not perfect, but I'm like,
no one is.
Yeah,
no
exactly.
One is. I mean, this is not a black and white thing. This is a field of gray.
Right.
You know, and it's okay to have bad days. It's okay to have cheat days. What's ultimately important is the grand scheme of things, following that healthy lifestyle and benefiting from it.
Yeah.
It is interesting, though. There are some emotional difficulties that can happen, especially when someone has gone through such a transformation, even after plastics. And it especially involves the physical activity piece.
Yeah.
You're not used to being laid up. You actually enjoy your activity level.
Right.
So a lot of times that can be a little bit of an emotional roller coaster. So just kind of prepare for that. Understand that it'll pass. It's a limitation for a specific amount of time, you know?
Yeah. How much is too much movement for my healing? Like, I know I can't work out, obviously, but like, if I want to at least walk.
Yeah, just every day, go nuts.
Okay.
That's all okay.
Right.
You're not going to do any damage there. It's more of the activity of your arms.
Right.
You know what I mean?
Right.
I don't want you walking miles and miles right
Right.
away. That'll just cause a deposition of fluid. It just kind of things are moving around a lot. So I want you to take it easy, at least for the first week. But I've got a lot of patients that have really rigorous exercise routines, and I allow them to kind of get back into some cardio using other body parts after that second week or after that first week, and then ease into it. By 2 weeks out, you should be good for cardio. 4 to 6 weeks out is when you could start doing more strenuous stuff. And for your case, that's when you really start stretching out those arms. You're going to do activities like stretching your arm out, like on a doorstop or on a wall, and just trying to like reach. You're going to feel very constricted.
Right.
And we don't want to get what's called a scar contracture, and that can happen in the armpit. If you limit your movement too long, like for months, when you pull up, you'll have this rubber band of dense scar tissue, and it actually can limit your mobility. So we don't want that to happen either. It's this balancing act. We want the most ideal scar, but still full mobility.
Right. Yeah. Makes sense. I feel like as we keep talking, and more stuff comes to mind.
That's how it is. You know, it's a
Yeah.
process, and that's why you have my cell phone, and we're partners in this.
Yeah.
So if you need anything, you know, I'm here for you.
Gotcha.
Okay.
Well, thank you. Thank you so much.
Absolutely.
Wonderful. Thank you so much.
It's my pleasure.